Hi, my name is Katherine Jia, and I'm currently a postdoctoral associate in the Department of Global Health at the Boston University School of Public Health, and a member of the Society for Epidemiologic Research. This article is titled Defining and Estimating Outcomes Directly Averted by a Vaccination Program when Rollout Occurs Over Time. We defined the causal estimate to quantify outcomes directly averted by vaccination. That is, the impact of vaccination for vaccinated individuals, holding the population vaccination coverage fixed for vaccination at multiple time points. This is a lower bound on the total outcomes averted among both vaccinated and unvaccinated individuals when the indirect effect, that is, the effect in unvaccinated individuals due to population vaccination coverage, is non-negative. We developed an unbiased estimator for the causal estimate in a randomized control trial and explored the bias of a popular hazard difference estimator frequently used in empirical studies. We showed that even in an RCT, the hazard difference estimator is biased if vaccination has a non-null effect, as it fails to incorporate the greater depletion of susceptibles among the unvaccinated individuals. In simulations, overestimation is small for averted deaths when infection fatality rate is low, as for many important pathogens. However, overestimation can be large for averted infections given a high basic reproduction number and a high vaccine efficacy against infections. Additionally, we define and compare estimate and estimators for avertible outcomes, that is, outcomes that could have been averted by vaccination, but were not due to a failure to vaccinate. The main limitation of the study is that our framework considers an ideal RCT, assuming no confounding, no selection bias, perfect compliance, and no other sources of bias. But in reality, these assumptions are often violated. Future research could use observational data to emulate a target trial similar to the one described here for estimating vaccine-averted outcomes. In conclusion, we defined a causal estimate for directly averted and avertible outcomes for vaccine rollout programs under interference, and evaluate the bias of the commonly used hazard difference estimator relative to the causal estimate under different values of the basic reproduction number, infection fatality rate, and vaccine efficacy against infection and death. Our study may improve studies in quantifying and interpreting the averted and avertible outcomes due to infectious disease interventions at multiple time points, including but not limited to vaccine rollout programs.